Let me tell you a little bit about the Water and Sanitation Program. We're a program that's decentralized in 24 countries around the world in 4 separate regions. Our mandate is to support governments to build good policies, to develop capacity to implement these policies, and then to also communicate about these policies so that all citizens are aware. So even though we're administered by the World Bank, WSP itself makes no loans and does no financial transfers to our clients. So WSP's one and only product is knowledge. That means that you are our key partners. WSP's proudest moments are when a good piece of knowledge is understood by governments, turned into relevant policy, implemented, and citizens benefit from that. And we cannot do this without you. So it's a real privilege for us to be able to join you in this conversation this afternoon. Clearly, I think some of the topics that you're going to be discussing are much more technical than I personally can participate in, and that's why our colleagues are here, because in WSP we have a range of specialists, from capacity specialists to generalists to financial analysts, and then also to economists and researchers. And we think that this kind of mix is very important to make sure that we can communicate to our most important clients, which are the governments that need to implement these policies, good evidence-based policies for the citizens to benefit. So as you get started in this afternoon's discussion, I'd like to share 3 lessons with you in terms of where we see research being able to inform good policy decisions. The first is the research topics have to be selected that are appropriate for government policymakers. In the water and sanitation sector, the biggest question that we've all been talking about is scale and sustainability. We know that on a small scale basis, how water and sanitation and health impacts are affected by different types of services that are needed. But how does it work at scale? And what kind of interventions achieve sustainability? Those of you who've been working in the sector know that really the government of Bangladesh is probably arguably the first government to really achieve rural sanitation at scale. From about 2003 to 2006, the government of Bangladesh did a very innovative behavior change and collective community decision-making process to achieve rural sanitation outcomes, and achieved really large-scale implementation of rural sanitation, and it's quite notable even today. But the second question that we're all struggling with, sustainability. How do we know that what type of outcomes are sustainable? And we know that many of you have been doing studies on sustainability of certain projects. But WSP wanted to know, can we actually look at sustainability on a national scale? So we partnered with the government of Bangladesh to go back and look at sanitation outcomes that had been achieved during this total sanitation campaign to see which have been sustainable and what are the factors that might have contributed to sustainability. The short answer is sustainability in this campaign was very high. 90% of those families that had, those communities that had reached open defecation free status still were open defecation free today. And I think all of you who've been working in development know that this is it's a tremendous result. And the study that that's available on our website goes through the factors that were involved in designing the program, implementing the program, and the community's response to really look at what are the factors that are contributing to sustainability. So the first lesson is, when we formulate the research questions, we have to know what are the policymakers really concerned about, and make sure that our research topics are formulated in such a way that policymakers will immediately be able to see that relevance.